I would say that the quality of care that I got at home was superior, far superior. Before I ended up in the hospital at home program, I had been in the hospital for 5 days. I hadn't been in the hospital since my last child was born, and she just turned 50 years old. Being in the hospital was really very boring. I was home for 4 days when I had a relapse. After being in the ER for quite a while, I was finally put up onto a ward. The following morning, I was approached by a nurse. She started telling me about this program, trying to tell me I could go home. And I was a little leery, but who wants to be in the hospital when you can be at home? I was quite happy to say yes, thank you, I will go home. So when I got home, they set up this whole system. They gave me kind of a little monitor on my arm, and I also had a tablet that was right next to my favorite chair that I was sitting in. And every day, a nurse came to see me twice a day. When the nurse was here in the morning, we would communicate with the doctor at the hospital through the tablet.
She talked to the doctor each day.
Well, the tablet, for me, was the lifeline with the care team.
The tablet that she could communicate at all times. The monitor on your arm, it would take certain readings. Here you had a cohesive look at the whole thing.
The nurses were just fabulous people and very efficient and professional, but yet caring.
Somebody called to make sure everything was working. They made sure you knew exactly under certain conditions what to do.
Right.
You know, that gives you a very nice feeling that somebody is really looking after her to make sure she had the best medical experience outcome that possible.
Everything was wonderful. It was the greatest thing in the world, and if you can ever be able to be with hospital at home instead of being in the hospital, I believe that even with many diseases, hospital at home can be done.
The patient being more relaxed at home, then
helps
the medication
to heal.
wonders compared to you're in this tense environment in the hospital. Here the nurses, they spent as much time as they needed to explain what was going on, why you have to do certain things.
The best part of being at home was the food, my husband. Sleeping at home is far superior to hospitals. It's a wonderful world being at home.